Thank you very much. Good afternoon. It's a pleasure to be here, and I'm thrilled to talk about something other than COVID today. I kind of think about life, professional life as pre-pandemic now and post-pandemic. And pre-pandemic, my specialty has really been HIV and other STIs. So I'm pleased to be here chatting about it today. And I guess just in terms of disclosures, the other thing I just wanted to mention in terms of my background as well is I have worked with one of the other community-based organizations here in Providence for the last decade, Project Weber Renew. So I'm currently on their board of directors for the last 5 years. A lot of my work at the intersection of HIV and STIs has been focused on male sex work, which is certainly a marginalized population, and done a lot of research actually and programmatic work with that group in general. So this topic is not new to me. There's certainly elements that are new. But what I want to do today is just let the Commission know and give an update on HIV and sexually transmitted infections in general. I want to stick to the data and also touch on some of the public health impact as we talk about this issue and what the data shows. So first off, I'm going to talk about and just review the public health impact in general of sex work. I have some updated slides on behalf of the Department of Health about HIV, other STIs, and then just chat a little bit about the potential impact from a public health perspective about what decriminalizing sex work may mean and some of the pros and the cons. So as we think about sex work from a public health perspective and through a public health lens, sex work really intersects a lot of other issues that we all care about, certainly public health and otherwise. And this includes things from housing to poverty, substance use, mental health, discrimination, racism, just access to healthcare in general. And sex workers in general face disparities across all this. And I guess if you had to ask me, why as a public health person, why should we think about decriminalizing sex work? To me, it's really because when you have repressive policies against any population, really, you drive those behaviors underground, and you make it a lot more difficult to address these very important topics, these issues that affect not just the person, but also our community and our population. And so when I look at this from a public health perspective and through that lens, one of the reasons that we are talking about this is to really address some of these other issues that are, of course, major problems in our state, such as substance use, mental health, all these things really. So that's why it's important to focus on this, to talk about it. And the bulk of and this is my only study I'm going to show, research study, but this was a well-done review that reviewed the bulk of the data of what had been done to date in 2018 here. And what this study found was that repressive policies in general, looking at criminalization of sex work, has really been associated with these numerous things related to public health. And the first is sexual physical violence. In places that had these repressive policies, sex workers were increased risk of violence by almost 3 times. And what happened, and you can imagine, is in some of these situations is that these individuals were really put into situations that were unsafe and at risk of either sexual or physical violence. We'll talk a little bit more about this, but HIV, other STIs, the research and the public health is really shows that these folks are increased risk of HIV and other STIs by approximately 2-fold for sex workers in places that have these repressive policies. Related to that, condomless sex, these policies again associated with increased risk of condomless sex, which of course facilitates HIV, STI transmission, and even promoting some of what we spend a lot of times in public health talking about in terms of promoting condoms for folks that are having multiple sex partners, effective against preventing HIV and STIs. When you have some of these repressive policies, they discourage people from doing things like carrying condoms, like discussing these topics with your primary care physician so that they can provide the right sort of medical care that is for that person. And finally, just in general, some of these other policies do disrupt support networks, access to healthcare, as I mentioned, and in general, they just exacerbate existing inequalities that we see in our society in general. So I'm going to switch now and just chat a little bit about the HIV STI theme and present some of the data and an update on this in general. So the good news is that in general, when we talk about HIV, we've actually done pretty good as a state. Rhode Island in general is considered a low incidence state. There's high incidence places. We are not one of them, which is fantastic. Boston is. The rest of New England is not. So in general, across New England, Rhode Island, we're doing a fairly good job. And rates of HIV have remained relatively constant through the last 10 years here, and really for the last 10 to 15 years. You can see here that we tend to have about 70 to 80 new cases of HIV diagnoses a year, which is pretty good. And we as a state are really working on a number of initiatives to really get this to zero. And when we talk about getting to zero, it's really through routine HIV testing, really getting people tested. And that's recommended by all clinical guidelines, including the CDC at this time. Is hopefully, most of you have had a sexual health conversation with your doctor, regardless of your background. It's really recommended that we make HIV testing routine. So that's the good news, is that we made a lot of good steps in terms of HIV. The bad news is that other STIs are really significantly increasing across the state. I mentioned 70 to 80 cases of HIV. Well, if you look at chlamydia, look where we are, over 6,000 cases, 5 to 6,000 cases being diagnosed yearly for chlamydia. When we talk about chlamydia and gonorrhea, those are STIs that can have pretty severe complications, especially in people with vaginas and ovaries and uteruses. It can cause pelvic inflammatory disease. It can make one infertile. It can cause chronic pelvic pain. The problem with these other STIs is a lot of them are asymptomatic as well. And so you don't know about these complications until many years later, and a lot of people can suffer some of these sequelae. So this is another reason why we push routine STI testing, and certainly when people have risk factors, one of which, of course, is engaging in sex work. And so people that do engage in sex work should be routinely screened for STIs. If people don't report that to the public, to their physician, their provider, then they may not get tested, and we see that happen all the time. What's also striking here is gonorrhea. I think about gonorrhea and chlamydia as being similar. They tend to cause, both can be asymptomatic, no symptoms, so it can be tough to know when people do have symptoms. Can cause those severe things, both of them, which I mentioned. The other STI that we routinely follow here in Rhode Island is syphilis as well. And syphilis to me is one of those things, if you look here, really exponentially increased over the last 20 to 30 years. I mean, many fold increased. There's an association between syphilis and HIV. A lot of syphilis is among men specifically. We definitely see it in the male sex work population. It's something that's associated with HIV. But we're also seeing an uptick, even here in Rhode Island, in congenital syphilis. And congenital syphilis is a big deal because kids, unborn babies, do die from syphilis, and it can cause very severe complications. And we're starting to see syphilis disseminate into some of the more generalized population. This is happening across the United States. These trends that I'm showing today are specific to Rhode Island, but they are reflected in general across the United States. So, and these are the infections that we know about. If I were to ask you what is the most common STI, you would say maybe HPV, which you'd be totally correct, or HSV, the second most common. We don't even have great numbers for those. So these other STIs are really just exponentially increasing, and I have a couple thoughts in a slide or two about that, why that may happen. The other thing of note to just mention about STIs and HIV in general is that there are significant disparities among different populations. So when you look at African American Black individuals, they have a 5 to 8 times higher rate. These numbers that I'm sharing today are for the entire United States, not specific to Rhode Island, but we see those disparities reflected in our state as well. When you look at the Hispanic Latino community, 1 to 2 times higher rates of STIs. And when you look among the LGBTQ community, and specifically cisgender gay and bisexual men, you see dramatically higher rates of HIV, as well as syphilis, gonorrhea, et cetera. So pretty much a lot of these marginalized groups we can think of here have significant disparities, and all these to some degree overlap with sex work as well. Finally, I always get questions, thought I would include this slide, I always get questions of why are STIs increasing? And again, they're increasing across the US as a whole here. We do believe that it's a combination of both behavioral and infectious components. We know that folks in general are using condoms a little bit less. There's a number of reasons for that. Some of it is due to effective contraception. There's also pre-exposure prophylaxis for HIV prevention, a pill a day which prevents HIV treatment. So people in general are, we believe, using condoms left, and some of the evidence supports that, and also just HIV treatment. And that's one huge advance over the last 10 years in HIV in general, is that when someone is infected with HIV, one pill once a day, minimal side effects, people do really well. And once they get on their medications, they aren't transmitting HIV to other people in general. Huge advance for HIV in general. It's a fantastic thing, as is PrEP, but some of this does lead to decreased condomless sex, which can certainly facilitate STIs. The other thing too that we've been made aware, if I asked you, can you get STIs through oral sex? Many people may be less familiar with that, but the fact of the matter is that HIV is rarely, if ever, transmitted through oral sex, but these other STIs are commonly transmitted through oral sex. And in my experience in talking to my patients and hearing from people, people rarely use condoms for oral sex, ever. So we do believe that a lot of the STI transmission may be facilitated by oral sex as well, which can be fairly common in many different groups. We're also seeing an association, certainly with riskier sex in general, with substance use and addiction. I think that's something that's probably familiar to most of us here, but certainly many substances can facilitate and disinhibit, including alcohol, riskier sex. And all this, by the way, has been exacerbated really by the pandemic, certainly for substance use. So we're seeing some problems with that. If you notice the last couple graphs I showed, we did see a little bit of a dip in STIs in 2020 when we locked down. And people in general were probably, based on word on the street, is that people were generally having less sex partners in 2020. But things basically in 2021 and early experiences in 2022 are really taking off right where it ended in 2019, meaning dramatic increases still across the board in STIs. The other thing too is that there's less awareness about STIs and less concern in general. It's true that HIV, in my opinion, can be the most serious of the STIs. People can certainly die if untreated and it progresses to AIDS. Again, with treatment, people generally do well and can lead normal, otherwise healthy lives, but you have to take that pill a day. Other STIs are much more subtle and a lot of them are asymptomatics. In a few percent of people, you can see some of these severe complications, but they tend not to be life-threatening. People tend to worry less about these STIs. And as I mentioned, some of these behaviors which are less pertinent to HIV transmission, like oral sex, can certainly facilitate these other STIs. The other thing too that we've seen across the United States, as well as here in Rhode Island, is that these issues, when we talk about other STIs, tend to get less attention and less funding as well. So there's really just a fraction of funding being pushed into STI treatment, infrastructure in general. A lot more money has gone in to address HIV, but public health infrastructure is really limited in general to address STIs. And finally, my last slide here, and just to kind of summarize, and then happy to open it up to any questions, is that we know that STIs are significantly increasing across Rhode Island. There is evidence across multiple studies that repressive policies in general and criminalization of sex work can lead to adverse health outcomes among sex workers, including a higher risk of HIV and STIs. There's also some evidence suggests that removal of some of these criminal and administrative sanctions, if you will, for sex workers can improve the health of sex workers in general, access to care, and by proxy, the health of the greater community. But in general, regardless of this, we really need to improve access to health, frankly, for all people, including for sex workers in general. And that's just good medicine and it's good public health. So I'm going to stop there. Happy to answer any questions that are specific to any of this. But thank you all for your attention and your time.